জি স্যার, আসসালামু আলাইকুম স্যার।
হ্যাঁ, শোনা যায়?
জি স্যার, শোনা যাচ্ছে স্যার। স্যার ভালো আছেন স্যার?
হ্যাঁ, আছি, ভালো আছি। তোমাদের সবাই ভালো আছে? তো তোমরা কেমন আছো?
জি স্যার, আলহামদুলিল্লাহ স্যার, ভালো।
ভালো আছো? পড়াশোনা করতেছো ফাঁকে ফাঁকে?
জি স্যার।
পড়াশোনাটা রেগুলার করবো। অ্যাটলিস্ট ডেইলি 5-6 ঘন্টা করে পড়াশোনা করবো। তাহলে পরীক্ষা দিতে আর অসুবিধা হবে না। তো আমরা তোমাদের এই মেডিসিনে রিটেন কোশ্চেন আলোচনা করেছিলাম। আবার ডক্টর চিন্ময় রিভিশন শুরু করছে। ডক্টর গণেশ বাবু উনি ওই তোমাদের অসপি যে টপিকস গুলি ওগুলি পড়াচ্ছেন। তো আমি এখন ভাইবার কিছু কোশ্চেন তোমাদের সঙ্গে আলোচনা করব। তো এগুলি যদি তোমরা পড়ে ফেলতে পারো তাহলে তোমাদের থিওরিটিক্যাল প্রিপারেশন হয়ে যাবে। এরপরে কলেজ খুললে আমরা তখন শুধু কেস দেখাবো, কেস পড়াবো, তাহলে তোমাদের পরীক্ষার প্রিপারেশন কমপ্লিট হয়ে যাবে। এইভাবে তোমরা প্রিপারেশন নেওয়া শুরু করো।
জি স্যার।
তো আজকে আমরা কার্ড ওয়ানের যে কোশ্চেন গুলি সেগুলি আলোচনা করি। প্রথম কোশ্চেনটা ছিল হোয়াট আর দ্য ফিচার্স অফ অ্যাকিউট এলপিএফ। এটার অ্যান্সার সিমটমস এবং সাইন এই দুইটা ভাগে ভাগ করতে হবে। Among the symptoms of acute LPF, initially exertional dyspnea, then orthopnea. Orthopnea means dyspnea during lying flat. আরেকটা হচ্ছে PND, paroxysmal nocturnal dyspnea. It means dyspnea during sleep. In addition to this palpitation, even dyspnea at rest can occur in severe form of acute LPF. Among the sign, first of all, you should see the pulse. And in pulse, you will get tachycardia, and character of the pulse will be pulses alternans. Pulses alternans means alternate strong and weak beat. Next, precordium. In precordium, apex beat shifted and heaving in nature. Heaving means thrust, persistent thrust. This is called heaving. And in lungs, bilateral basal capitation present. Bilateral basal capitation you can get in other conditions like bronchiectasis. But in bronchiectasis, the capitation will alter after coughing. But in case of pulmonary edema or LPF, the capitation will not alter after coughing. Our next question was, what are the common causes of tremor? So, common causes of tremor are thyrotoxicosis, fine tremor. Next, Parkinsonism. In case of Parkinsonism, you will get resting tremor. That is tremor at rest. And next, cerebellar lesion, you will get intention tremor. That means tremor during doing some work, or like holding pen, you will get tremor. Senile tremor, it is forced tremor and it occurs in elderly patient. It is idiopathic. And next is drugs. Drugs, among the drugs, salbutamol is the common drug that produces tremor. Our third question was, what are the alarming features of dyspepsia? Regarding dyspepsia, we have discussed that dyspepsia means a cluster of symptoms like fullness of abdomen, loss of appetite, and vomiting tendency, uh, bodogmy. These are the different features in a patient of dyspepsia. But here the question is that what are the alarming features of dyspepsia? Dyspepsia is a very common symptom for people, but when it is alarming, it is alarming when dyspepsia is associated with anemia. That indicates the patient may suffer from, say, stomach, vomiting, the patient may gastric outlet obstruction or your cholecystitis, polylithiasis, pancreatitis. So it is alarming. Weight loss. Again, bronchogenic carcinoma causes weight loss. Loss of appetite. It can occur in bronchogenic, SCA stomach. Hematomesis and melena. It also occurs in CA stomach. And dysphagia, esophageal carcinoma, and carcinoma of the cardiac part of the stomach. And palpable abdominal mass in case of carcinoma of the stomach. So these are the alarming features of dyspepsia. So if a patient has got dyspepsia with any one of the symptom, then we will take it as a organic lesion and we will investigate the patient to detect the cause. Our next question, what investigation you will do for SLE? Blood, common investigation, ESR will be raised, hemoglobin will be reduced, and this anemia is acquired hemolytic anemia, and there may be leukopenia, WBC count may be reduced, platelet count may be reduced. ANF is positive in 95% cases of SLE, and anti-double stranded DNA antibody positive in 30% cases. And urine, proteinuria and hyaline test. Behavioral test may be positive, but it does not indicate the patient is suffering from your syphilis. Next question, mention two complications of scabies. Skin infection is a complication of scabies, and the name of the infection is impetigo. And kidney complication, post-streptococcal glomerulonephritis. So these are two of the common complications of scabies. Our next question is, what are the presentation of benzodiazepine poisoning? Benzodiazepine, we have, as for example, sedatives like your common sedatives, benzodiazepine, it produces poisoning. And in case of benzodiazepine poisoning, you will get drowsiness. First symptom is drowsiness. Second, the patient may be confused. And third is ataxia. Ataxia means abnormal movement in walking. And respiratory distress indicates a severe form of poisoning. Hypotension, it also indicates severe poisoning. Stupor and coma, these two are the late complication of benzodiazepine poisoning. Our Next question is, what are the presentation of gout? Two types of gout. One is acute gout, another is your chronic gout. In acute gout, the presentation sudden onset of pain involving mostly the metacarpophalangeal joint of the big toe, and the joint is red, hot, and tender. Ankle, knee, wrist, elbow, shoulder may be affected, but the commonest site of affection is metacarpophalangeal, metatarsalophalangeal, not carpo, metatarsalophalangeal joint of the big toe habitat, and marked swelling of the joint. Malaise fever may be present. But in case of chronic gout, tophi is present. Tophi means irregular form of nodules that is deposited around the fingers, hands, forearm, and elbow. So presence of tophi indicates it is chronic gout, and tophi is irregular form of nodular deposit. What are the cardinal features of leprosy? Cardinal features of leprosy is skin feature. In case of tuberculoid leprosy, the skin lesion, depigmented or hyperpigmented skin lesion with loss of sensation, and the lesion spread and discrete lesion, a small discrete lesion, and it is asymmetrical presentation. It is not widespread lesion. But in case of leptomatous leprosy, the lesion is papulonodular skin lesion with anesthetic patch, and diffuse skin lesion, symmetrical lesion, and skin become thick, and there may be loss of eyelash, giving the appearance of leonine face. So leonine face is a characteristic feature of leptomatous leprosy, and it is diffuse lesion, it is widespread lesion, it is symmetrical involvement. So these are the character of leptomatous leprosy. And among the nerves, the common nerves affected are posterior auricular nerve, radial nerve in the forearm, in the arm, ulnar nerve, median nerve, common peroneal nerve, sural nerve, posterior tibial nerve. And the nerves become thick and tender. At the same time, there is loss of sensory and motor function. So card 1 is completed, and now card 2. What is X-linked recessive disorder? X-linked recessive disorder is a variety of genetic disorder where male is affected but female are carrier. Hemophilia, Duchenne muscular dystrophy. In card 2, the second question is, what are the features of right heart failure? Again, the clinical feature consists of symptom and sign. Symptom, swelling of the legs, and sign, leg edema, raised JPP, enlarged tender liver, and left parasternal hip. Our next question is, what are the causes of coma? CNS cause of coma are stroke, meningitis, encephalitis, subarachnoid hemorrhage, head injury. Metabolic cause, hypoglycemia, diabetic ketoacidosis, non-ketotic hyperosmolar diabetic coma, edemia, hyponatremia, hepatic coma. And next cause of coma are poisoning, like benzodiazepine poisoning and OPC poisoning. Our next question is, what are the causes of ascites? The common causes of ascites are CLD, abdominal tuberculosis, abdominal malignancy, and other causes are congestive cardiac failure, nephrotic syndrome, malabsorption syndrome. What are the predisposing factors for gout? Some drugs initiates gout, like thyroid diuretics, low-dose aspirin, and pyrazinamide, that is anti-tubercular drug. So these drugs are responsible for gout. And diet, high protein diet, especially red meat, alcohol, and some disease like CRF, chronic myeloid leukemia, chronic lymphatic leukemia, and also inheritance, genetic cause also excites the gout. What are the characteristic features of acute eczema? The skin rash, papulovascular skin rash with red, swollen, irregular margin. Margin is red, swollen, and irregular. And the skin rash containing papulovascular rash with itching. There may be exudation and crack in the lesion. Scaling, that is dry skin, scaling can be present. So these are the presentation of acute eczema. Now, what are the complications of measles? The common complication of measles are bronchopneumonia, that is pneumonitis, pulmonary tuberculosis, encephalitis, meningitis, gastroenteritis, hepatitis, vitamin deficiency, and immune deficiency. So these are the complications of measles. What are the common poisoning you have seen in world? Answer will be OPC poisoning, benzodiazepine poisoning, snake bite, arsenic poisoning, paracetamol poisoning. So this 5 poisoning is common, and it should be read and memorized. Any one of the poisoning can be asked, and most important is OPC poisoning for diabetes. What are the complications of heat stroke? The complications of heat stroke are cerebral edema, hepatic failure, renal failure, shock, disseminated intravascular coagulation, and pulmonary edema. Now we are, I think, part 3. What are the clinical features of Down syndrome? The features of Down syndrome are short stature, flat nose, mental retardation, single palmar crease, congenital heart disease like ASD, atrial septal defect. Patient is very fond of music and reduced life expectancy. What is cardiogenic shock? Shock due to cardiac disease is known as cardiogenic shock, and the common causes of cardiogenic shock are myocardial infarction, LVF, pulmonary embolism, hypertrophic cardiomyopathy. So these are the common causes of cardiogenic shock. What are the causes of acute diarrhea? Among the virus, rotavirus, Among the bacteria, E. coli, Salmonella, Shigella, Staphylococcus aureus, and Vibrio cholerae. And what are the causes of bulbar palsy? Bulbar palsy means the lesion in the medulla oblongata. Lesion in the medulla oblongata causes bulbar palsy. And in bulbar palsy, usually the cranial nerves 8, 9, 10, 12, and 11. This 8 is not usually involved. 9, 10, 11, 12. These four cranial nerves nuclei usually present in the bulb or medulla oblongata, and they are affected. And in bulbar palsy, the features of this fourth cranial nerve lesion will be present. And the cause of this bulbar palsy are hemorrhage in the medulla oblongata, ischemic infarction in the medulla oblongata, and any tumor in the medulla oblongata which produces bulbar palsy. What are the diagnostic features of SLE? Among the diagnostic features, there are 11 features of SLE. Out of this, butterfly rash, photosensitivity. Photosensitivity means intense itching and discomfort, burning on exposure to sunlight. Next is discoid rash. It occurs in different parts of the body. Oral ulcer, usually ulcer in the heart palate. Arthritis. Arthritis, large joints are commonly affected. Serositis means either ascites or proliferation can occur. In blood, there may be anemia, leukopenia, thrombocytopenia. In kidney, there may be hematuria or proteinuria. In brain, there may be psychosis or convulsion. And ANF and double-stranded DNA antibody, these two are the immunological criteria. So 9 clinical criteria and 2 immunological criteria, total 11 criteria. So 4 criteria out of this 11 is diagnostic of SLE. What is heat stroke? Heat stroke is a life-threatening condition when body temperature is above 104 degree Fahrenheit or 40 degree centigrade, and it is characterized by hot skin, loss of sweating, shock, renal failure, and other complications. What are the commonly affected nerve in leprosy? Already we have discussed, and it is posterior auricular, radial, and ulnar nerve, median nerve, common perineal nerve, sural nerve, and posterior tibial nerve. Name the causative organism of scabies. Sarcoptes scabi is the organism causing scabies. What is Turner syndrome? It is a chromosomal disease which occurred in female and genetically expressed as 45X0. And the features are short stature, primary amenorrhea, waving of the neck, a lack of secondary sex characters, fish-like mouth, hypertension, coarctation of the aorta, low set ear, shield chest, inflammatory bowel disease, and reduced bone mass density. What are the common causes of osteoporosis? I think you know what is osteoporosis. Osteoporosis is a metabolic bone disease where the total bone mass is reduced. And the primary cause in male senile osteoporosis and in female postmenopausal osteoporosis. And the secondary cause are Cushing syndrome, rheumatoid arthritis, ankylosing spondylitis, hyperthyroidism, chronic liver disease, malabsorption, drugs like steroid. So these are the cause of secondary osteoporosis. So I think this is the end of today's class, and we have gone through 27 questions, and these questions are very first line question. If you can answer this first line question, then chance of pass is more. But if you don't know the first line question, then it will be very tough for you to pass. So I hope that you will read this first line question and try to answer it so that you can easily pass the Viva exam. So I again hope and pray to Almighty God that you read regularly with healthy life and peaceful mind, and I hope best for you. Thank you all.
Thank you, sir. Sir, Assalamu alaikum.
বুঝতে অসুবিধা হয়েছে? আজ বুঝতে অসুবিধা হয় নাই? তো ঠিক আছে, আমরা খুব তাড়াতাড়ি এই ভাইবার কোশ্চেন গুলি আলোচনা করে ফেলবো। আমাদের ভাইবা হয়ে গেল, রিটেন হয়ে যাবে। ভাইবা হয়ে গেলে, রিটেন কোশ্চেন হয়ে গেলে, পাস কি হয়ে গেলে, দেন after opening up the class, you will go to patient and you will see the patient, and your preparation will be completed. So again, thank you all.